Well, it had nothing really to do with me. It had more to do with my daughter because she had a liver transplant and I lived in the hospital for a year. So I kind of, they made me do a lot of things because I showed proficiency and they wouldn't give me help. So I had to learn how to, they wouldn't give me like an in-home care nurse. So I had to learn how to do everything myself.
Who is they?
The social workers at the hospital, they was like, oh, you can do it. And so like I had no choice. I had to do her manual blood pressures. I had to run her IVs. I had to do everything at home by myself. So then I was like, well, hell, I might as well learn the science behind it and get paid. So that's literally how it went.
So, or would those things have been provided with insurance? Did you have insurance at the time? So why didn't they provide you with those?
Well, they provide insurance for people who need it. So it's not just a matter of medical need. It's during, because they provide all the parents with training in the hospital. So had I been, an idiot or, shown that I could not be dependable during that process, then they would have provided me with a home care nurse.
Okay. So did you know anyone else who had a home care nurse?
At the time, no. I found out later.
You found out later that you could have gotten one?
Mm-hmm.
It wasn't made readily, available to you?
No, it wasn't clear that I knew that some people kind of had them, but I didn't know how to go about it, or that it was clear. It was just always told to me, oh, you can do it.
Oh, they just assumed that you would be able to, and which you obviously were.
Yeah, but it was really stressful. It would have been nice to have, not to juggle IV, laundry, and dinner,
Mm-hmm. And how old were you at this time?
That was 2 years ago, so 26.
Okay. So how old was your daughter when she had her liver transplant?
9. She was born in December 2010. She got it in September 2011.
And is it okay if I ask why she had one?
She had biliary atresia. So it's okay. So it's a condition where the bile does not drain from your liver. So she also has other complications that now I've learned are generally precursors to her disease. She has situs inversus. So her internal organs are
mirror image.
Yeah, but they're not exactly a mirror image, but none of them are where they're supposed to be. And so she also has polysplenia. She has multiple spleens. So all those things. She had no gallbladder. It was underdeveloped. And it's just a genetic thing. They don't know why it happens.
So when you don't have a gallbladder, what does that mean?
Generally, your gallbladder is just it's like the stoplight for the bile. So when you eat something, it lets bile drain. Your gallbladder just lets bile drain from your liver into your small intestines in order to help you digest. But when you don't have one, because your body produces bile all the time, nonstop. And when you don't have one, it just drains. It's supposed to drain. But hers was not functioning properly, nor was it draining. So what they tried to do is they tried to do Kasai, where they take a piece of your small intestine and hook it directly up to your liver. And it didn't work. So her liver started to, show signs of cirrhosis. So it was dying, basically. So she was going into end-stage liver failure right before she got her transplant.
How long was she on the transplant list?
Since she was maybe 3 months after she was born. So she got her Kasai when she was 2 months old, and then when the Kasai failed, they knew immediately. So they put her on the transplant list. And
how did they know that she had liver problems?
Well, I noticed when she was first born, she came home 8 pounds 2 ounces, 19.5 inches, big baby, no problem. And regular delivery, vaginal birth, good. So we go home, and a couple weeks later, I start noticing her eyes are turning yellow. And it's summertime. And so I take her, of course, I take her to the pediatrician. They're like, oh, it's breast milk jaundice. I now know that is stupid because breast milk jaundice would have presented at birth and not 2 weeks later. And so now it's, 4 to 6 weeks in, and her eyes are highlighter yellow. And my baby, she looks like she has a beautiful gold tan. And so, it's cute because she's chocolate. Had she been a white baby, she'd look strange. But so I took her and I was like, no, there's something wrong with this baby. And then they took her in, the nurse practitioner, and then she finally got the doctor to come in. And so there was like immediately go to Children's, get lab results. And about 2 weeks later, we were in the operating room.
Could this have been fatal if it would have lasted longer?
It could have. But there's no way you miss it. Like, her eyes are highlighted. If you look at the baby, you know there's something wrong. Like,
but then they told you that it was breast milk jaundice when it wasn't.
Yeah, I've learned now, in my experience, that's stupid, but I also have learned that that's a common, misdiagnosis in the beginning. But in the next couple of weeks, they know, if it doesn't go away, that's what they say. If the color does not go away from her eyes, then bring her back. And that's what I did. They scheduled me an appointment, and I was like, no, she's got to. But if she had not gotten her liver transplant, she wouldn't have made it to her now 3rd birthday.
Well, congratulations for that. That's great.
That's all I say. She wasn't supposed to be here, but she is.
So with her liver elements and things, is she developing normally?
Relatively. She's kind of short, but which is a little odd because I'm 5'7" and her biological father is 6'2". So. But we're going to see the geneticist. We actually have an appointment in September to, check on how things are connected. Because everything so far when they, because the first thing they did was check her heart, make sure everything is connected properly, and it was fine. So it's just in wrong places. So, because of that, they also removed her appendix because it's on the wrong side, and had it ruptured, no one would know because it's in the wrong place. So we're going to make sure, like, things like if she's able to have children, how her uterus is shaped, and, this just the different mechanisms internally to see what will happen.
If your daughter hadn't had these medical elements, you said that you wouldn't have been a nurse. What would you have been doing otherwise?
I probably went back to work. I was managing Starbucks, and I also do taxes, and yeah.
The hustle.
Yeah, hustle.
So do you feel like how do you feel like you have any advocates in your life for medical help?
Like, for me or for my daughter?
For you.
No, not really. But I'm very in tune with myself. So, like, when something's wrong, and before now being, poor, and on Medi-Cal, I've always had really good health insurance and medical benefits. So literally anytime something was wrong, I went to the doctor, like every single time. And that's how I was raised. So it's kind of, now it's a little different. Because I do have to, like, go through this appointment process, which generally lasts 3 months, and then I forget to go, and then whatever was wrong is no longer wrong in 3 months. So unless I go, drop in. So now, not really, but I still go, even if I have to sit there all day.
Do you think that, okay, so I started doing this project because I read Audre Lorde's cancer journals. And it's about, Audre Lorde is this poet and activist and philosopher, basically, who became sick with, I think it was liver cancer and I think breast cancer at the same time. Or her breast cancer metastasized and then her liver also. Yeah. And then, and it's just this series of these beautiful, well-written journals about her interactions with healthcare institutions and doctors that treated her, like she was a piece of meat, basically, and that were really against, like, homeopathic remedies and things of that nature. And it just, like, details how they basically were very racist and, like, horrible to her. So in my research, I started thinking about, like, why is it that African American women have so poor outcomes when it comes to healthcare? Just in every single way, in breast cancer, in diabetes, in HIV and AIDS, in all of these things. And I was just wondering if you had any thoughts about like why that is.
I'm not sure why. Like, I did experience things like when I was in the hospital with my daughter where like I noticed a huge difference in the way the male doctors treated me and spoke to me and about my daughter, as opposed to the female doctors how they treated me and spoke to me. The female doctors spoke to me as if I was a person, and the male doctors kind of, I felt like they talked down to me often, like, oh, I'm just some poor little black girl. And like they spoke to about my daughter as a patient, and I found myself on numerous occasions going, Marie, like, she has a name. She's more than just the potential transplant patient, biliary atresia in room 6. Like, that is not who she is. And so, like, I've found like a lot of experiences like that, but I'm not, I mean, I don't know, it's just, it seems like it's all, the whole system is kind of, messed up and treats us poorly, but I'm not, you could always say it always stems back from slavery and from us always being in a lower status and treated as such. And, we're the lowest on the totem pole. We can't even say we're, a man. So.
Do you trust your doctors?
I pick my doctors. So that's the difference. Like, I've gone to the doctor and be like, no, I don't like you. Like, you make me feel weird. And then requested a new one. But I'm proactive like that. Everyone doesn't do that. Everyone thinks that the doctor that they get, especially when you're on Medi-Cal, thinks that the doctor that you get, you have to stick with. And no, I don't. That's my vagina. Like, I don't. Everybody can't just be messing around down there. And this is my health, and I need you to. If I feel like you can't answer my questions or you can't talk to me like I'm a human being, especially now that I have like a little more knowledge as to what the science behind what's going on with me and my body, if you can't answer my questions as if, I'm your peer, then I don't want you taking care of me. So,
but
I'm a little different.
You didn't. Do you trust the ones that you pick?
Yeah, I trust the ones that I pick.
Okay.
So. The establishment as a whole, maybe not so much so, because like it took me a while to get to ones that I trusted.
So what would be your advice as somebody who hasn't spent a lot of their adult life navigating the health field and is now like about to be a player in the health field? What is your advice to other folks?
Like, in terms of like finding a doctor, or in terms of just. Ask me that question again.
Well, I mean, in terms of finding a doctor, like being a mom with a child that's sick, and also being a woman that needs their body taken care of, what would your advice be to navigate that?
If you feel uncomfortable, immediately switch doctors. No matter what your insurance is, like, you have to feel comfortable with the people who's going to take care of you. And when you find that person and develop that rapport, like, stick with it. And because it's all about that comfortability. If you don't have that, it makes it really uncomfortable. And you don't want to go to the doctor. And I wouldn't want to take my kid to a doctor that I didn't feel comfortable with. Like, I love my daughter's nurse practitioner. I have her cell phone number. I text her when there's a problem. Like, Marie has a rash and texts me back. Like, okay, I'm writing you a script for hydrocortisone cream. Go pick it up. Like, love it. But I do recognize that everyone's not going to get that. But you have to look for it. And if you are determined to look for it, you can find it.
All right. Thank you.
You're welcome.